Now let me explain what is the process of this treatment called IVF or test tube baby. In this treatment, we ask a patient to come for about 5 times to the clinic in a duration of 12 days. That is, about 4 to 5 visits are required for ultrasound scans and maybe twice or thrice blood tests. We do the ultrasound scans serially in these 10 to 12 days to see the growth of the follicles, which will give us eggs from the woman. And after which, during these 12 days, every day, the woman is expected to take injections at a specific time. Now, with advancement of technology, these injections are non-painful. She can administer it on her own, like the elders we have seen taking insulin at home. These injections can be self-administered and they are absolutely pain-free injections. So there is no pain during the process of injection taking in IVF treatment. After 10 to 12 days, when the follicles are about 17 to 18 millimeters in size, it is time to give them the last injection, that is called as the trigger injection, which is time specific. And after 34 to 36 hours of this trigger injection, we do the IVF, that is called as ovum pickup, taking out of the eggs outside the body from this woman. And also, we have already taken the semen sample also on the same day, or maybe we have asked the husband to freeze the semen sample in the IVF clinic. We prepare the semen sample in the andrology lab, and then we fertilize these eggs in the IVF lab. And what egg and sperm is fertilized, it forms something called embryo, or bhroon is what it is called in Hindi. And once these embryos are formed, we decide to either transfer 2 or 3 embryos in the same cycle of the same woman, or maybe a surrogate in her case if she requires a surrogate transfer, meaning somebody else's uterus will carry her child. Or we freeze the embryos and then transfer in what is called as frozen embryo transfer cycle. Now let me explain in a simpler way. If a woman has had 9 embryos made out of her one IVF cycle, she will have a very good chance of conception with the advancement of technology of freezing, because in one cycle we transfer maximum 2 or 3 embryos. If she becomes pregnant in the very first cycle, very good. She has those balanced 6 embryos to come back after 2 years, 3 years or 4 years for her second child, and now she does not need to go for IVF. She will only have the lining of her womb prepared and the embryo transferred, and chances of conception are very high. And let us say she fails in the first IVF cycle. She still doesn't have to repeat the entire IVF cycle again, because the embryos which have been frozen for this couple can be again used by just simply preparing the lining on some tablets for a few days and doing 3 or 4 ultrasounds to see the lining of the uterus, and again transferring back these embryos, which again have a very good chance of conception. It is every cycle of IVF has 40 to 50% of chance. So it is every transfer we do, that carries 50% chance or 40 to 50% of a chance for conception. So if a person who's had 9 embryos will have about 90% chance to take a baby home or to become pregnant with those embryo transfers. So this is what, in nutshell, is the IVF process. Stay more tuned. We will give you more information about IVF, IUI, what are the terminologies used, what is the cost involved, what are the myths about IVF. I will be talking about it in the next video.